Dr. Lane Freeman. I've been privileged to work in this practice for almost 20 years. It is such a blessing to work with such an amazing staff and so many wonderful patients as we seek to help people heal and improve their overall health through treating the oral aspect of the mouth-body connection. We are constantly on the lookout for the best technology and the most effective protocols that will help our patients detox and heal quickly. We have seen that the mind affects the spirit and the body. The physical, mental, and spiritual health of our patients is always our utmost concern.
Dear Father, I just thank you so
Treating
much
each person and their case as unique and individual allows us to develop a special relationship with our patients. Our ultimate goal is to serve each other and our patients with joy. We look forward to partnering with you in your health journey.
I'm Dr. Candace Owens, and I love being a part of this practice. We pride ourselves on treating the whole patient. Here, I have the time to really get to know my patients, and many times I get to know their friends and family who accompany them. It's fun to see parents, grandparents, and caregivers gain understanding of the impact that good dentistry can have on overall health for generations to come. Fixing teeth and removing infection is rewarding, but the real joy comes in collaborating with our doctors and wellness professionals to educate patients and help them fully heal.
I'm Stuart Nunnally, and one of the great joys of my life is being one of the partners in this fabulous dental practice of Nunnally, Freeman, and Owens. Years ago, I began to have neuromuscular issues. After months and months of testing, I was finally referred to the ALS Center in Houston, thinking that maybe I had Lou Gehrig's disease. And as it turned out, I did not have that issue. I had a mercury toxicity issue. As a result of that whole experience, our practice was transformed and we became a very holistically oriented practice. We still love to do things in a very aesthetic way, but we're very, very careful about what materials we use and making sure that we support someone's immune system. I'm so grateful for that time years ago when I had the illness, because now I'm able to empathize with those patients who have similar issues. To do what we do today is so much more rewarding than what we did in years past. So it's just one of the great blessings of my life to be associated with my partners and my staff, to know that the Lord is totally in control of this practice and that the practice is completely surrendered to Him, and that we have the opportunity to serve people from all over the world. It's absolutely a tremendous joy.
At Nunnally, Freeman, and Owens, we offer a wide range of treatment options centered on the needs of our patients. Whether you need mercury fillings or metal-containing restorations replaced, infected teeth removed, cavitations debrided and cleaned, or periodontal therapies, we follow specific protocols for each type of treatment in order to protect our patients and give them the optimal environment in which to heal and detox. Some of these protocols may differ from patient to patient based on unique needs. On almost every surgical patient, and most of our restorative patients, we will incorporate some type of sedation. For most, it is appropriate to use IV conscious sedation, which is administered by the dentist performing the procedure. All of our dentists have been certified for many years and undergo intense continuing education to maintain their skill set and safety in this area. IV conscious sedation is very safe and, best of all, allows for a pain-free procedure that you won't even remember. Occasionally, based on either the amount of surgery needed or health issues, an anesthesiologist is required to provide a deeper sedation and sometimes even general anesthesia. We have state-of-the-art diagnostic capabilities using a 3D image taken with a cone beam X-ray unit. This allows us to see every tooth root and possible pathology and surrounding bone in 3 dimensions. It helps us identify the relationship of teeth to other parts of the anatomy, such as sinuses and nerves. With surgical procedures and mercury removal, we always administer vitamin C in IV form. That allows you to receive a much higher dose than you would be able to stand orally. Vitamin C aids in detox, in healing, and in preventing infection. We use acupressure to encourage lymphatic flow and drainage and allow muscles to relax, which helps prepare the patient to enter and come out of surgery in a comfortable state. Acupressure promotes healing, minimizes pain, swelling, and bruising, and it helps the body shift from the sympathetic state of fight or flight to the parasympathetic state of being relaxed. Another really exciting aspect of our protocols is how we treat the surgical site. After thoroughly cleaning each site, we incorporate ozone to eliminate infection and increase blood flow, and we use PRF, or platelet-rich fibrin, to enhance healing. The patient's own blood is spun down into a concentrated form, much like the clot the body forms naturally, but this gives us immediate platelets in solid form congregated together. This platelet-rich fibrin is then packed into the site so we avoid dry sockets and kickstart the healing.
Periodontal disease is a significant problem for many Americans. It's basically an infection within the gum tissue that causes bone loss around the teeth. It's caused by specific types of bacteria, and the resulting infection causes inflammation that slowly destroys the gums and the supporting bone. These gum infections can affect your entire body, and they can significantly increase your risk of systemic diseases. In America, it's so widespread that surprisingly more teeth are lost to periodontal disease than tooth decay. Our office is equipped with a state-of-the-art phase contrast microscope that allows us to see on a video screen the type of bacteria in your mouth. If you're infected with these types of pathogens, there's great news. We have the team to help you overcome periodontal disease.
Our hygiene team at Nunnally, Freeman, and Owens has over 100 years of experience, and we have all done extensive continuing education to comprehensively treat patients when it comes to preventing and treating periodontal disease. By seeing your dental hygienist regularly, we can remove the buildup on your teeth and lower the bacteria by using ozone, which kills the bad bacteria without harming the good. You may need to see your hygienist for several visits to get the bacteria under control. We work with you to create a personalized plan to defeat periodontal disease.
For over 100 years, there have been discussions over the safety of root canal treated teeth. Weston Price, one of America's foremost researchers, published an exhaustive 2-volume, 1,200-page treatise on the link between oral infections and systemic disease. Price realized that a dead tooth, whether treated with a root canal or not, could not be sterilized. Thus, the tooth continues to harbor pathogens that can have an impact on a patient's well-being. We are convinced at Nunnally, Freeman, and Owens that root canal treated teeth in some patients can lead to serious health issues. Recently, Price's research has been repeatedly corroborated with multiple scientific articles demonstrating that the bacteria and the toxins associated with root canal treated teeth may be responsible for increased risk of heart attack and stroke. Another recently published article demonstrated that root canal toxins are associated with major depression and a lowered quality of life. We never take the removal of teeth lightly, but what you can be assured of is that at Nunnally, Freeman, and Owens, you will always be well informed of the benefits and risks associated with treatment. Our goal is to see you flourish, not only in terms of your oral health, but also in terms of your systemic health.
Dental amalgam fillings, which are made with a mixture of mercury, silver, copper, tin, and sometimes zinc, are still used in the United States and a number of other countries. Often called silver fillings, all dental amalgams are about 50% elemental mercury. Mercury is toxic and it can accumulate in the body, making it hazardous. The use of mercury in dental amalgam fillings poses significant risk to human health, and when not disposed of properly, can be released into the environment. In most cases, we recommend the removal of any amalgam fillings in your mouth.
When a patient comes to us to have their mercury fillings safely removed, it is important that we follow a set of guidelines and a set protocol in order to consistently protect the patient and the staff from particles of mercury and mercury vapor that can escape during removal. This is why our office chooses to be trained and certified in the SMART protocol, or Safe Mercury Amalgam Removal Technique, developed by the IAOMT. We are in compliance with federal, state, and local regulation in terms of handling, cleaning, and disposing of mercury-contaminated components.
The word cavitation is a term that is used to describe an area in bone that has little or no blood flow and is filled with bacteria and their toxins. The most common bones to have a cavitation are the upper and lower jawbone, in which cavitation is most often referred to in the scientific literature as jawbone osteonecrosis. The most common sites for a jawbone cavitation are where a tooth has previously been removed, especially the wisdom tooth sites. Over our 20-year history in surgically treating cavitations, we have been astounded by the DNA and toxicology analysis of the contents from these lesions. The toxins produced from the anaerobic bacteria within the infected jawbone can produce or contribute to a wide variety of systemic health issues, ranging from neuralgia to autoimmune disease. Treatment consists of making a small incision over the infected site, curating out the diseased bone, and filling in the void with the patient's own platelets and stem cells. We have found this surgical technique, which is virtually painless, to be very successful, and countless patients have testified to the improved health following the procedure.
When a patient loses a tooth or has teeth surgically removed, we understand it's a very personal and important issue. Nunnally, Freeman, and Owens offers many options to our patients. While we believe it's wise to replace a missing tooth to prevent other teeth from shifting and causing problems with occlusion and function, it isn't always absolutely necessary, especially upper back molars. We also offer removable partials, fixed bridges, and for some, biocompatible implants. All of these options for tooth replacement will be based on your individual case. We refer all of our implant cases to a specialist for a full evaluation to determine the best course of treatment.
Hi, I'm Karen Cantlin, and I'm a patient coordinator here at Doctors Nunnally, Freeman, and Owens. Our mission statement is to please God in all of our patient and staff interactions. And with this staff, we are very loving to one another, we pray with one another, we encourage one another, and we hope that that joy that we have spreads over into our patients as well. When you call into our office, you will not get an answering machine. We want you to come in and just automatically feel that relief, release any fears you might have, and just know that the staff has prayed over you and that you are part of the family.
At Nunnally, Freeman, and Owens, our first priority is you. Our protocols are cutting edge, but it's the people here who make all the difference. That's why patients from around the globe travel to Marble Falls, Texas. We are dedicated to your wellness, and we look forward to partnering with you to create a personalized plan to help you achieve your goals. Our website is a valuable resource, and you can find in-depth videos on all the topics we've introduced. Contact our office if you have questions or to make an appointment. We would love to welcome you to the family.